All right, Ethan, I guess you can get started.
All right. Alrighty, so good afternoon, everybody, and thank you for joining Absolute Genomics' fourth webinar on sexual health. My name is Ethan Anderson, and I will be moderating today's webinar. I have a background in computer science, having an associate's degree from Johnson College, and I manage biological specimen processing here at Absolute Genomics. And today's speaker on the subject is Dr. Abbas Raza, who has an extensive background in the study of infectious diseases, having a PhD from the University of Vermont and having a postdoctorate from the University of Massachusetts Medical School, and is currently the Director of Operations here at Absolute Genomics. This webinar will consist of a 30-minute presentation and a 5 to 10-minute Q&A session at the end, and everybody is encouraged to leave a question or comments in the chat box. With all that being said, I'll now hand the floor over to Dr. Abbas.
All right, so thank you, Ethan, for the kind introduction, and hello, everyone. So this is a nice outline of how this talk is structured. I'll give you all a very brief overview of Absolute Genomics Laboratory and the variety of infectious disease panels we perform. I'll then go over the current scope of sexually transmitted disease epidemic and review some of the risk factors, educate us on the causal pathogens and the treatments available. Then I'll introduce some of the more advanced methods to identify an STD, which includes both RT-PCR-based methods as well as antibody-based diagnostic panels that we have designed at Absolute. And then we'll wrap up with how you can actually get started with us and a Q&A session, which I'm sure everyone will be leaving some questions. All right, so Absolute Genomics, our lab, is a high complexity molecular testing laboratory, and we offer services in not only infectious disease diagnostics, but also personalized genetic testing. We started operations back in 2020, and we're still pretty young, and we have expanded our operations to now we include 300 plus clients that are associated with us. We have our physical presence not only in Pennsylvania, but we also have a presence in Missouri where our corporate headquarters are. Our mission statement, which is mentioned here, that's what we live by. We want to provide accurate and timely results, which are unmatched in terms of the cutting edge diagnostic solutions available for any particular disease or infection. And we pride ourselves in providing service with unmatched turnaround time. And most of the panels are completed within 24 hours. And what that means is we can provide a possible treatment option for the patient early on so they can be on the path of recovery. Our quality control, which is another thing we really pride in, is comprised of several healthcare professionals with MD and PhD level accreditation. And we are also accredited by both CLIA and CAP, that speaks for the quality of standards we maintain at Absolute. There are several diagnostic panels we offer currently. Several of them are infectious disease based, such as respiratory pathogens or specific to UTI infections or STIs we will be going through in this webinar. And we also offer some genetic tests, such as PGS testing. And we are continuously expanding depending on our client needs. You can actually learn more about these by visiting this website here. All right. So getting started with the topic of today's webinar, let me share some staggering statistics on the scope of this STD problem. I will be using STD, STI, so sexually transmitted disease or sexually transmitted infection, interchangeably, so they mean similar. So it is quite astonishing to know that almost 1 million STIs are acquired every single day globally. And this situation is no more different in US. If you just look at the STI infections every year, that number is like 26 million, according to the latest CDC estimates. And this actually translates to every fifth person in the US having an STI infection. And even more alarming is half of these infections happen in young adults. And since many of these infections can ultimately lead to birth and reproductive complications, this is extremely alarming. Now, if you look at the prevalence of these STDs, we know like there are more than 20 different kinds of sexually transmitted diseases, but globally, some are like they have much higher prevalence than others. So if you look at just globally, you can see like, for example, herpes is very, very common compared to say HIV numbers are pretty low, or like overall, you can see like each STD has particular prevalence. And the situation in US is also no different. You can see like herpes is still quite common here. But for example, hepatitis B and C, they're pretty low in US. Now, these numbers, even though I was showing them as bar graph, but if you look at the actual number of patients, still that's quite alarming. And this begs the question, how come we see so many affected individuals? I mean, they don't get treated, they don't get diagnosed. So this will be actually made clear in the next slide. So many STIs are actually asymptomatic. What I mean by that is they won't exhibit any signs and symptoms. Normally, when we talk about a disease, it exhibits a symptom, and that's how we know, someone is having a disease, so they need to be treated. But these STIs, majority, like up to 50%, for example, Hep B, bacterial vaginosis, or trichomoniasis, they don't even exhibit any symptoms. And that's the main reason many people don't get tested, and they are so common. And not only because of that, they get transmitted easily. So they're also very infectious or contagious. I won't say infectious, contagious. So people can actually be living with STI for many years without even knowing it. And the only way to do it is to get tested, irrespective of the symptoms. That is why we call STI the hidden epidemic. They are extremely common and they are invisible. All right, so what can go wrong if, say, an STI is not treated? So an untreated STI can cause long-term damage. And here I've listed some of the complications that we see in sexually transmitted diseases. Take as an example, pelvic inflammatory disease. This can make it difficult or almost impossible to have children. And so especially for women, if they get this disease, this could have, extreme consequences. Then this disease, which is this complication, this is an example of congenital syphilis, which is passed on from infected mother to a child, and it can lead to blindness and brain damage in the infant. Similarly, there are other complications which are specific to, say, individual bodily organs, such as liver. So Hep B and Hep C viruses, which cause hepatitis B and C, if they are left untreated, they can lead to liver cirrhosis, hepatocellular carcinoma, and ultimately death. Then we have some STDs such as HIV, which cause AIDS. They can weaken the immune system, so much so that even just harmless pathogens can actually cause disease. So many of these individuals ultimately end up with a life-threatening infection and die. So thus, it is very important that these STIs are diagnosed and treated. Another issue we face in the STD is the emergence of antimicrobial resistance. And I have actually a slide designated just to cover this topic. So antimicrobial resistance, if some of you may not know, is considered a global public health emergency. Yet the impact of this antimicrobial resistance in sexually transmitted infections is often underappreciated. In fact, if you look at the latest report from CDC, they have identified this pathogen, Neisseria gonorrhea, which causes the disease gonorrhea, among the top 5 urgent antibiotic-resistant threats to the public. And if you just look at this picture, almost 60, 70 years ago, gonorrhea was easily treatable by a very cheap antibiotic, penicillin. But if you look at the current situation of treating gonorrhea, Now gonorrhea cannot be treated by penicillins, sulfonamides, tetracyclines, macrolides, quinolones. So the only treatment available is like the ceftriaxone. So it's a big, big issue. And because many STDs are, there are many bacteria responsible, we need to be aware of developing antimicrobial resistance. In addition to this, STDs could be extremely costly to the healthcare system. So if you just look at the estimates from CDC, that puts the number to almost 16 billion in direct medical costs. So some diseases, they make up the bulk of it, like chlamydia, gonorrhea, syphilis. They alone contribute almost $1 billion to the healthcare system. And then, some require lifelong treatments, such as HIV, and some, like HPV, they require long-term treatment, whereas others can be treated much earlier, such as chlamydia or gonorrhea. All right, so now let's review some of the common STIs. What are the risk factors for them? What symptoms, if they have any, whether they are caused by bacteria, virus, and how best to treat them. So we have some STDs such as bacterial vaginosis, which primarily affect women. But there are others such as HIV or herpes, and then others, as I will mention in other slides, which are equally, they can happen in both men and women. There are a variety of risk factors responsible, and they are listed here. For example, some could be, purely by sexual route. Some can also be transmitted by blood transfusions, sharing needles, so that could be responsible. There are a variety of pathogens that may be responsible. For example, bacterial vaginosis can be caused by several bacteria. There are some which are caused by unique viruses like HIV, which causes AIDS, or the herpes simplex virus and the different HSV1 and 2, which causes herpes. And then the treatments also vary. If it's a bacteria, there could be an antibiotic. If it's a viral infection, such as HIV, there could be antiviral treatments. Okay, if you look at these three categories, syphilis, chlamydia, and gonorrhea, they are all caused by bacteria. And so they are treated by antibiotics. But as I was mentioning earlier, one must implement antibiotic stewardship to avoid unnecessary use and misuse of these life-saving medications and avoid any antimicrobial resistance. Some of these STDs, such as Hep B and Hep C, they can actually, as I was mentioning, lead to liver damage. And we are also seeing antiviral resistance developing in these viruses. So that is also not good. Then we have trichomoniasis, which is in fact caused by a parasite. So that's very different from other STDs. And it is actually very, very common. It is easily treatable, but again, 70% of individuals who have this disease, they don't exhibit symptoms. So this brings us to why it is so important to have STD screening irrespective of the symptoms. So here I have listed some of the things that one should know, why STD testing is so important and how it can help. First and foremost, if someone has STD testing done in time, they can reduce their symptoms. So the symptoms could be general, they could be specific to a particular STD. So knowing, if someone has an STD, it can greatly help in the treatment plan. Secondly, because STDs can go unnoticed, undetected in a community, in a population, by doing STD testing, one can avoid this rapid spread of these STD diseases. And so think of it, all these huge numbers of STD infections we see, we can actually avoid by providing STD screening to the communities and the individuals. Third, many STDs are curable. So by providing STD testing, we can actually cure these patients from these pathologies. Fourth, early testing and screening can actually help in the prognosis of the disease. What I mean by that is if someone gets diagnosed, as an example, for, say, Hep B or Hep C, early on the disease is quite manageable. whereas later on, if it crosses a given threshold for the viral number, copy number, it's very hard because the damage has already been done. So screening early on can really help in having the patient recover quickly. And last and obviously the foremost, one can avoid all these long-term complications which were mentioned earlier on. Okay, so this brings us to what kind of solutions Absolute can provide as a laboratory. So at Absolute, we offer 3 diagnostic panels for STD testing. These include Sexual Health InSITE, STI InSITE, and Women's Health InSITE, and I'll walk you through each of them. So this is our first panel, the Sexual Health panel. It covers 3 viral pathogens, HIV, Hep B, and Hep C, and 3 bacterial pathogens, which are responsible for gonorrhea, syphilis, and chlamydia. This panel is actually highly sensitive and specific to these targets, and these are the numbers that we saw in our validation study. We are able to perform both RT-PCR and antibody-based detection in this, depending on what the requirements are from the CDC, and we are able to deliver results within 48 hours. All right. Then we have the STI InSITE, which is a panel that covers 13 pathogens. This can serve as a very comprehensive screening panel for individuals, and you can see like it has quite a lot of bacteria, both aerobic bacterial pathogens as well as anaerobic bacterial pathogens, and fungi and parasites and viruses. And last, we offer Women's Health InSITE, which covers several additional pathogens that are unique to women's physiology, as you can see here. And this is by far the most comprehensive STD panel we offer. Not only do we provide diagnostic information for all these pathogens, but we also run them for antimicrobial resistance. And the ones that are highlighted here with the asterisk, these are the targets we run for antimicrobial resistance. And this is reflected in our ABX Advantage panel, which I'll show you here. And this actually tests for 11 antimicrobial resistant genes. These cover actually 6 different antibiotic classes. So you can see here. So by having this information in the form of this comprehensive antimicrobial report, the physician can actually look at the best treatment options for a particular STD and thus implement antimicrobial stewardship, which is required by the CDC to be implemented by healthcare settings. All right, so how do we get started, or any of you in the audience can get started with Absolute? So getting started with us is pretty straightforward. We have excellent and friendly account managers that are more than happy to assist you with every step of this process. I will be sharing with you emails of myself and our Absolute Genomics team, so you can reach out to them directly as well, and we can walk you through all the steps which are listed here as well. All right, so I am very excited to have such wonderful testing personnel at Absolute who contributed towards this presentation. And now let's open the floor for a Q&A session, and I'll hand it over to Ethan to coordinate this.
Alrighty, thank you, Abbas. So we encourage all of you to leave like a question of any kind in the chat. I'll open up this floor with a couple of questions I wrote for myself, but feel free to give a question of any kind. Alrighty, so first question, how frequently should somebody get tested for STDs?
Yeah, Ethan, so as STD can exhibit no symptoms, that is a big problem. So one might not know they have an STD unless they get tested. So the recommendation is to be tested frequently, and depending on how many sexual encounters one has or they suspect the partner may be infected. So it's always important to do as frequently as possible.
Alrighty, so next question. How can I prevent myself from contracting an STD?
Yeah, so STDs can be contracted by the sexual route. That's obviously one of the ways. So practice safe sex. So condom usage, that is important. Secondly, many STDs can be transmitted through, say, the blood products, blood transfusion. So those need to be properly screened for all these STD pathogens. A third route is, for example, Hep B, Hep C. They are transmitted through sharing needles, so syringe usage. That needs to be prevented. So that is another way. And of course, if one can get tested early on, so screening is essentially so important. That way, one can isolate the individual and prevent further transmission chain that I was mentioning. Okay.
Thank you. Alrighty, so this next question comes from the chat. Can you tell me more about the ABR report and the associated drug recommendations?
Yeah, so let me actually go back and give you guys a more detailed version of the ABR report. All right, so Absolute tests for any antimicrobial resistance that may be present in the detected pathogens. So those pathogens which I listed, such as the bacteria, they may be carrying antibiotic resistant genes. So what I mean by that is the antibiotic may not work for those particular pathogens. So what we do is we run the samples from the patient on these 11 resistance markers, which are shown here. And based on the resistance, the report generates a drug of choice, so highlighted here, which is best suited for the patient. So as an example, if someone has a resistance marker for methicillin, so maybe they have a bacteria that carries, say, MEC-A gene, the antibiotic prescribed for this patient may not include any from this class. And that actually avoids any complications long term because we are not prescribing any medications that may not work. And so it eliminates the guessing game that normally happen. If someone is prescribed an antibiotic, by using this antimicrobial resistance report, one can ensure that this antibiotic is the best treatment of choice for that patient. And this report also takes into account other things such as, are there any side effects of a particular antibiotic? And if say a patient is sensitive to, say, they cannot use penicillins, so the penicillins won't be recommended in this report. So it's more like a personalized way to treat a patient. And I'm happy to elaborate on this further, but if you check, we have a full webinar on antimicrobial resistance, and you can check it out on YouTube as well, and also on our LinkedIn page. There it talks in more detail. I hope that answered the question.
Alrighty, thank you, Abbas. So next question. Early stage sexual transmitted diseases without symptoms are not contagious. Is this true?
Oh, wonderful question. So does it matter if I am in early stage or in late stage? Is the contagiousness of the virus or the bacteria same or different? So that is a misconception. Generally, it's the same. So whether if someone has symptoms or no symptoms, they will be equally transmittable. So it is thus very essential that someone gets tested for STD, whether they are early on in the infection or later on, they will still be transmitting the virus or the bacteria or the fungi.
All right, thank you. So the next question comes from the chat. So why is antibiotic resistance so common, and what can we do as a society to be done about it?
Wonderful. Whoever asked that question, excellent. So the issue with antibiotic resistance is not new. This has been happening as soon as we started using antibiotics. Bacteria, they can evolve resistance to all these antibiotics that we use. So as I wish I had a chart to show you, as soon as these different antibiotic classes were discovered, bacteria started developing resistance, and then they can pass on to, there's a way to transmit the resistance as well. So that is a big problem. And because we haven't matched discovery of new antibiotics with the resistance that is developing, so we are actually running out of in this race. So we have less antibiotics available, which are still effective, and there are a lot more antibiotics which we know don't work anymore. So there is a very important need to develop new antibiotics. And plus, we also need to have antibiotic stewardship implemented in all these healthcare settings, because the resistance happens because we prescribe antibiotics without even knowing whether it's a bacteria or the virus. In fact, 50% of the prescriptions are not even needed. As an example, say respiratory pathogens, majority of them are viral infections. But how many times do we actually perform comprehensive testing before prescribing an antibiotic? So that can promote further. So it is very important we prescribe antibiotic only when it's needed, and then prescribe the medication which is the best treatment of choice. So such as using an antimicrobial resistance report. So that can ensure the bacteria doesn't have this liberty to develop for the resistance. Okay?
Alrighty, thank you. So next question, why should we be concerned about STI infections if they are asymptomatic at first?
Yeah, so STI infection, this majority of them are asymptomatic, and that doesn't mean they are not going to cause any disease later on. So they can be causing subclinical disease. They are also infectious, like contagious, so they can still be transmitted. So even if someone has no symptoms, they are contributing to this epidemic that I was mentioning. So that's why it's very important they get treated. And especially people, who are planning to have kids, these STDs can cause long-term complications. So both in men and women. So in women, it can cause birth complications, stillbirths, and then pelvic inflammatory disease, like some of the examples. In men, it can cause urethra problems, difficulty in urination, and then there are other symptoms. And they can also increase the risk of getting HIV. So all of these are pretty, serious complications. So it is very important to get tested.
Alrighty, thank you. Alrighty, so next question. Is it possible for gonorrhea to be contracted from a public or shared toilet seat?
So gonorrhea is normally transmitted through the sexual route. So yeah, I would say no. So, but there are many which can be transmitted pretty easily, such as chlamydia and those other diseases, which can be transmitted through bodily fluids as well. But specific to gonorrhea question, it is transmitted through the sexual route.
Alrighty, thank you. Alrighty, last question from me. Early stage sexually transmitted diseases without symptoms are, oh, I'm sorry, I've already asked this. All right, so if left untreated, which STD could cause deafness and death in its later stages?
Yeah, so one of the disease I mentioned, syphilis, and there's a particular type of syphilis called congenital syphilis, which is passed on from an infected mother to a child after delivery. So that can actually lead to, blindness, and it's quite, detrimental to the infant. So yeah, I hope that answered that question.
All right, thank you. And this question comes from the chat. Do parasites like trichomoniasis develop resistance as often as bacteria?
So it's very rare, and most of these parasitic infections, because it's a different pathogen, different biology, they have different ways to develop resistance. But currently, it's mostly bacteria which develop the resistance. But that doesn't mean these parasites don't have the potential later on to develop. So that is why it is very important. We don't prescribe all these medications unless there is a medical need to prescribe them. Okay?
Alrighty, thank you. All right, so I think that's going to about wrap it up for our Q&A session. Thank you all for your questions. If we didn't reach any questions, please feel free to email either me or Abbas through our respected emails. Today we learned about all the common STDs spread through sexual activity, the epidemiology, and the importance of early diagnosis. If you would like to learn more or have Absolute Genomics do your sexual health testing, please visit our website at www.absolutegenomics.com and come visit our LinkedIn page where we post articles relating to our panels and other forms of content daily. Again, thank you all for joining our webinar, and we hope you have a wonderful day.
Thank you. Thanks. Take care. Bye.
Take care, everyone.